Good day, ma'am. Before anything else, I'd like to introduce myself first. I'm Alexandria A. Argalias, your student nurse from Adventist University of the Philippines. And you are?
Rafael Angeli M. Garcia.
Miss Rafa, so before we proceed, I need you to tell me if you're comfortable here.
Yes, I'm comfortable.
Is the temperature doesn't bother you?
Yes.
Okay. Before we start, I need you to verify your personal information here. So your name is Rafaela Garcia. You're 19 years old from Cainta, Rizal. And your sex is female. Your birthday is November 19, 2003. And your place of birth is Angono, Rizal. You don't have race.
Yeah, I don't belong.
Okay. So your language is Filipino and English. You are not married. You are single, right?
Yes.
And your religion is Seventh-day Adventist.
That's correct.
You are level 1 first year college.
Yeah, because I'm first year.
Thank you. Before we get further, I'd like to let you know that in order for me to help you for today, I need to ask you some questions, particularly about your health and medical background, and some of your personal circumstances. Is that be alright?
Yes, that will be okay.
Okay. So your answers will be documented so that we will able to formulate the best care that you need. Do you have any questions?
No, I don't.
So let's get started.
Okay.
So what brings you here today, Miss Rafa?
I came here today because I sneeze all the time. Then I get my eyes watery.
Oh. Yes, I've noticed that your eyes is red and watery. Is it itchy?
Yes, super itchy.
Can you describe how does it feel?
My eyes are so itchy right now. Then whenever I sneeze all the time, then my eyes are really so watery.
When did your symptoms first begin?
I don't know what exactly, but I think it started when I was young, my childhood days, my grade school.
Since it began, did they get worse or is it the same since it began?
No, it's just the same.
Okay, the same. Can you point or describe the exact location where your discomfort is?
It usually starts here in my nose.
Okay, no. Does it occur anywhere else?
No.
Are your symptoms seasonal?
Yes.
How often do you have symptoms?
It usually starts from like 8 p.m. until 8 a.m. in the morning.
Okay. Does it disturb your sleep?
Yes, all the time. It always disturbs my sleep.
So, what factors relieve your pain?
So I use prescription like antihistamine, steam inhalation, and humidifier.
What makes your symptoms worse?
Whenever I inhale dusts.
Does it relieve when you apply your medication?
Yes, it helps me.
Okay. What medication do you apply?
So my pediatrician recommended me immunotherapy that provides me long-term relief from my itchy nose and watery eyes.
Okay. So, have you ever needed a treatment?
Treatment? No.
No.
Just always follow the doctor's orders.
You use natural ways.
Yes.
Do you have any therapy to manage your pain?
No, I don't.
Okay. Is there anything you would like to add?
No.
Okay, ma'am, is it okay to you to ask some your past history?
Yes.
Okay, can you tell me if the symptoms is the cause of your problem at birth?
No.
Do you experience the symptoms during childhood?
Yes.
Have your symptoms caused you to go to emergency room?
No.
Are you admitted to overnight to hospital?
No, I've never been admitted.
Can you tell me all prescription and over-the-counter medicine you're currently taking? Include oral, inhaled, injected drops, and sprays.
Oh, so right now I have here my sodium chloride salinase. Then I use antihistamine like cetirizine, then betahistine. Then I do the steam inhalation.
How number of times do you take it per day?
Every morning and every night.
Do you have allergies to any food? Can you specify it?
Yes, I have allergies to chicken, black crumbs, then eggs.
Do you have any of these like glaucoma, diabetes, AIDS, depression, high blood pressure, or other significant medical problems?
No.
Okay. Have you ever smoked or does anyone in your family have smoked?
I don't smoke, but I do have a member in my family that does smoking.
Do you notice how many pack or sticks?
No, I
Okay.
don't notice that.
Does anyone in your family experience these symptoms or pain?
No, it's just me.
Okay, just you. How do symptoms affect your family?
Because I always wake them up at night because I need their help for my steam inhalation, to get my prescription drugs, and that's all.
Okay, is your parents still alive?
Yes.
Do they have illness too?
No.
Okay. So, tell me, how do you start your day, Miss Rafa?
I usually start my day like 5 in the morning. Then I always get my phone to check if there are any notifications.
Okay. Do you do exercise?
No, just the walking.
Okay, it's good. Do you drink plenty water a day?
Yes.
Okay. Do you smoke or drink alcohol?
No.
So, good. Are you on a diet?
No.
Okay. What is your height and weight?
I think my height is 5 flat. My weight is 40, 41.
Do you take vitamins?
Yes.
What vitamins?
I think the Supreme C. Supreme C.
Dream C. What is your typical meal a day?
Lutong bahay.
Okay.
Lutong bahay. Then, of course, the rice.
Do you take more rice or just enough rice?
The maximum amount of rice would be 1.5.
Okay. Do you consume enough food?
Yes.
Okay. Do you gain weight or lose weight?
Yeah, it's just the same.
Okay. Can you recall what you ate in the last 24 hours or in the last 72 hours?
I think I just ate chicken. Fried chicken.
Do you get enough sleep?
No.
Why?
Because I had to do some homeworks, but I usually sleep like 12. Then I woke up like 6 or 5.
Do you get enough rest with that?
Yes.
What is your social activities?
Oh, social activities. I joined choir in my school.
Okay, it's good. One more. Does your appetite, taste, or smell change?
No.
Is there any difficulties chewing or swallowing? Have you had any recent occurrences of vomiting, diarrhea, constipation?
Yes, diarrhea.
Okay. What is the texture of your poop?
When I have my diarrhea, sometimes it's like a water, not the solid one.
Okay. Can you describe me or tell me the color of it?
It's just normal, the brown one. Sometimes it has like little green.
Okay, ma'am. So, we're done with this important data. I'd like to sum up everything that we're covered. Okay, Miss Rafaela. So, we're done with those important document data. Now, I'd like to sum up everything that we covered, and if I might get error, feel free to correct me. So, you are Rafaela Garcia, 19 years old, and you are from Cainta, Rizal. And you came here in the hospital due to itchy or blocked nose and reddish watery eyes, and also a runny nose. Breathing can be sometimes difficult because it affects frequent coughing and sneezing.
Yes.
And to alleviate the condition, you use nasal sprays and antihistamine medication, and you mentioned that you use humidifier to control it. Also, a doctor recommend you immunotherapy to provide a long-term relief. Um, you don't have any other illnesses, but you have allergy to black grams, chicken, and eggs. And your family doesn't have illnesses, but you mentioned that one of your family is smoking, and that's it. Is there any? Would you like to correct?
No.
So we're almost done now, but I just have to take your vital signs, and I'd like to listen to your lungs if there are any abnormal sounds. Is that okay?
Yes.
Okay, so here is the result of your vital signs. Your temperature is 37.4. Your pulse rate is 70 beats per minute. Respiration rate is extreme breath per minute. Your blood pressure is 120/80. So now, I have to listen to your lungs. I noticed that there is a whistling or wheezing sound, but it is mild and it is noticeable when you exhale. But it's okay, and it is a sign of your allergic. Thank you, ma'am. See you.